I'm Dr. Matthew McNutt, orthodontist. Thank you for visiting our before and after collection. Investing in technology is very important to our practice so that we can provide every possible cutting edge to our patients and to stay a step ahead. Two specific areas that we'd like to point out in our practice is the use of a soft tissue laser and the use of orthodontic TADs, otherwise known as orthodontic temporary anchorage devices. I routinely use a soft tissue laser in my practice to help save patients many months in treatment. It's a healthy, safe, and effective way to cut treatment time down when certain circumstances arise. The most common circumstance where I use a soft tissue laser is when we have a tooth that fails to erupt. Here in this example, there's a canine underneath this gum tissue. The canine has tried to erupt down and in, and it has run into this thick fibrous gum tissue. Sometimes a tooth like that may take 6 months, 9 months, or even 12 months to come through, and there's really nothing between it and the blue sky but a little bit of gum tissue. In the old days, this situation might have been handled by writing a referral to an oral surgeon. Patient goes to the oral surgeon, has an injection to numb the gum tissue, and then a scalpel blade is used to cut a small window of gum tissue away. The patient then heals for several days, returns, and then braces can be bonded to the unerupted tooth. In my practice, I save the patient time and money. Instead of waiting for that tooth to come down and in, we can use the soft tissue laser to painlessly sculpt a small window in the gum tissue. The soft tissue laser is specially calibrated to cauterize the nerve endings and the capillary beds, so there's really no bleeding and no post-op discomfort. A brace can be immediately applied to the tooth, and then over time, it's brought down into the dental arch. Here is the canine after the brace has been applied, the wire has been used to move the tooth down and you can see that the gum tissue is very healthy. So going from here to here very quickly through the use of a soft tissue laser can save a patient time, money, and discomfort. The next area of technology to discuss is an orthodontic TAD, or temporary anchorage device. Orthodontists may also refer to TADs as mini screws or mini pins. You see on the screen several TADs, or TADs, of various lengths. You'll notice that it looks like a threaded screw, very similar to a dental implant, except for they're considerably smaller. Before the advent of TADs, certain types of tooth movement were very difficult for orthodontists to achieve in a predictable fashion. The temporary anchorage device, or the TAD, is inserted between the roots of teeth, and it's used as an anchor point to move single teeth or groups of teeth in ways that in the past would have been very challenging for an orthodontist. TADs can be placed in many different areas of the mouth and have many different applications. What's very interesting about them is that you can place these very painlessly for a patient. The gum tissue is numbed with a jelly, and the bone itself, where the TAD is inserted, really only feels pressure. We can quickly insert them. They can be used for months or years at a time in order to move teeth effectively, and then quickly removed. The key factor is for the patient to keep them very clean. So now let's look at a specific application for a TAD in one of my adult patients. What you see is an adult unilateral Class II malocclusion. For more information on what a Class II malocclusion is, visit our before and after page under Class IIs and watch our video. Let's look at these arrows. This arrow represents the direction in which we need to move this group of teeth in order to correct the bite. The black lines are drawn down the center or long axis of these teeth here. The purple line indicates where the tooth ought to be. So this black line should actually be here. So imagine moving this tooth back. Same thing here, and same thing here. In our next slide, we see braces have been applied. Here's the lower arch, here's the upper arch. We have a wire in the upper that's bypassing these two teeth and going through these back teeth. We have a vector TAD in place between the root of the canine and the lateral incisor, And there's a wire running through it with a coil pushing against these teeth. And here you see some tooth-colored composite material just for comfort. Now, in a traditional orthodontic patient with no TAD, we would have to use the front teeth to push against the back teeth in order to try to help correct this. We might also run elastic rubber bands from the bottom in the back to the top in the front. But we would have a net pushing effect on the front teeth to protrude them forward. Newton's laws of physics. For every action, there's an equal and opposite reaction. The goal of the TAD is to really make sure that we don't have any unwanted forces pushing these teeth forward and protruding them, and we focus the force only this way to move these back teeth back. The TAD device put between the roots of the teeth here really gives us a tug-of-war team that can't lose. So over time, what we would expect is a net movement of the back teeth this way to correct the bite, all through the innovative technology of a TAD. Thank you for visiting our before and after page. Clayton Orthodontics and Cary Orthodontics in North Carolina, thetoothmover.com, where we like to stay a step ahead.